I have personal experience using Quizartinib. We took place or participated in trial in a phase 2 study where relapsed and also refractory patients with FLT3 internal tandem duplication were included. This trial was recently published in Lancet Oncology, and there we really saw that, for example, an older patient, I remember very well, 75 years old with a relapsed AML, FLT3 internal tandem duplication positive, could be treated even on an outpatient basis. And this was really impressive. The patient achieved a complete remission. However, as we know, resistant mechanisms are in place, and in these older patients we are not able to move towards an allogeneic transplantation, and he finally relapsed after a time of 8 months. However, he were in complete remission for 8 months, and this was not expected before we used FLT3 inhibitors.
I have experience with Quizartinib. At MD Anderson, we did participate in the phase 1 Quizartinib study, which was published in JCO. This was a dose-finding study. One of the interesting findings from that study, which actually allowed all relapsed AML, so it allowed FLT3 mutated and FLT3 non-mutated. And one of the things that many times people, including experts, forget is that even in the FLT3 non-mutated group, Quizartinib actually had about a 32% marrow remission rate. So this is quite interesting, and there have been a lot of preclinical papers showing that although Quizartinib is a potent inhibitor of FLT3 ITD mutated cells, it also has very potent KIT and RAF inhibition. And we think that in some AML patients, even those who do not harbor the FLT3 ITD, the inhibition of KIT could be playing a major role. So that was one of the key findings we found out. We've also participated in both the phase 2 studies of Quizartinib. There were actually 2 of these that looked, one at the elderly relapsed AML patients, about 180 patients, and the other one looked at salvage 1 and 2 in younger relapsed AML patients. What's been very unique and interesting with Quizartinib has been that the response rates across all these studies, the phase 1 study, the 2 large phase 2 studies, and the Quantum R phase 3 studies, have been very, very, very consistent. So this is not something we often see in drug development in leukemia or other solid tumors. We usually see that the response rates drop off in the phase 3 because in the phase 2 you have very experienced centers, they manage the patients a little better, they have more leukemia expertise, and then when you go to a phase 3 you open it to 100 centers and you have a little bit of drop off. But with Quizartinib, what has been interesting is that the 50% bone marrow remission rates have been very, very stable in the phase 3, phase 2, and phase 1. So we believe that even in the community, probably the response rates will stay between 45 to 50%. So this is a realistic expectation, not just what was seen in trials.